My name is Haray. I'm a consultant surgeon, a specialist colorectal surgeon, and my base hospital is Prince Charles Hospital in Merthyr Tydfil, a town just north of Cardiff in South Wales. I'm also professor at the local university here, University of South Wales, and I undertake some private work at the Nuffield Hospital in Cardiff. I sometimes get asked what made me decide to become a doctor, or in fact, why even specialize in colorectal disease. Right from my early childhood, probably around the age of 5, I knew I wanted to be a doctor. One of my grand uncles was a surgeon, and I could see him and how his job gave him the opportunity to help so many people. And I knew that when I was 15, I knew it had to be a surgeon. I grew up in Bombay, now called Mumbai, in India, graduated as a doctor, and went on to train in surgery and spent several years as a trainee there. And then decided to come to the UK for further advanced training and started working in the NHS. That's when I really came across colorectal surgery, because at that time in India, colorectal surgery didn't exist as a specialism so widely. So this is an evolving branch, and I basically fell in love with it. And that's why I'm a colorectal surgeon today. This job is incredibly rewarding because it provides a fantastic, great opportunity to provide some help to people in their time of need when they're often worried, frightened, and to be able to help people and make them a bit better. Nothing is as satisfying as that. The thank you get when a patient is, being discharged from the hospital, having had their operation, and the relief you can see in their eyes as they walk away. And when they come back a few months later or a few years later, or send you a thank you card, those are incredibly, incredibly rewarding. I also have had the great good fortune to be able to work with a fantastic group of colleagues. And because my passion is teaching, I spend a lot of my time training future generations of surgeons. I'm so fortunate to be doing the job I do. Incredibly humbled by it, but most thankful for having been given this opportunity. I'd like to think that my patients feel that I genuinely care about them and that I would do everything I possibly could to help them. I'd like to think that I'm able to convey that to them. Patients, of course, give me a huge amount. I mean, they give me a fantastic. They're the reason I do what I do, because it's a fantastic reward just to be able to help people and privilege to be able to do so.